Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy podcast studio, and we are super excited to have Dr. Nammy Patel on our podcast today. She is a dentist down in Southern California, Central California, I believe. She will clarify that. And he's a dentist that talks about functional health and how um, our mouth is really important when it comes to our general health. And we really shouldn't be surprised about that because if you follow Janet and I on our podcast, we talk about how the gastrointestinal tract and GI health is so important. Well, the mouth is the first part of the GI tract. So Dr. Patel, welcome to our show.
Thank you for having me. I'm really excited. I'm really excited to share a lot of information and really excited to be with you guys. I'm looking forward.
Awesome. So give us a little bit of history about yourself.
My name is Dr. Nammy Patel. I've been practicing for the last 20 years. I come from a background of Ayurveda. I'm Indian. I grew up in India. I was actually born in my own house in the living room with trees in the front, trees in the back, trees to the side. So come from a very organic, sustainable background. And then pleasure of being in the United States, since I was 5 years old and going through schooling and looking at science has been my passion project. I love data. Decided to go to dental school and then got out and then I wanted to find my purpose. So I wanted to figure out how can I serve people in a different way. And what I discovered is that people were looking at teeth as just teeth. And we're really, there's a lot of science out there that really actually shows how your mouth is connected to the rest of the body. And in fact, how your teeth can actually help you live an extra 10 years, which is really awesome. And especially in a time where we're looking at being centurions, are really looking at how can we live longer and live long and be well, right? We want to make sure that we have a beautiful lifestyle, that we're able to, the biggest things that we look at is heart attacks, diabetes, cancer, Alzheimer's, right? We want to be 90 and still remember everything. We want to be 90 or 120 and still be able to walk up a hill. And I'm in San Francisco, so we have lots of hills here. So that's really my background, and my passion is really helping people live longer, richful, joyful lives. And so I'm really excited, and I can't wait to share all that I know with you and the people who are listening. I always invite questions, so please, I could talk all day, but please, interrupt me anytime. I'm very passionate about what I do, clearly.
Well, you know what? Now that you say that, we already have a question. Kim Clark from YouTube, and this is on the same subject, but maybe a little bit different, a tangent. Kim had a tonsillectomy when she was 5, and she wonders if that had anything to do with if it affected her immune health, and now she's at 48. Tell us about that, Dr. Patel.
Oh, absolutely. I'm so excited. Thank you, Kim, for asking that question. That's actually a really good question. So usually tonsils are not removed if at the age of 5 unless you're a mouth breather. So the people who actually end up getting their tonsils removed are people who can't breathe through their nose really well. And that happens for a number of reasons. Genetics, it could be if you were not breastfed. It could be the positioning of your tongue and things like that. So there's lots of reasons why that occurred. And that's a bigger topic. But the straight answer for you, does it affect your immunity? Absolutely, yes. And in a long way, it's actually a positive thing for you that you got your tonsils removed at the age of 5, because what that allowed you to do is to make sure that you had a more open and a functional airway. The reason why they removed the tonsils was they're trying to get you to breathe through your nose. Those tonsils were over-inflamed because you're always mouth breathing. And when you're mouth breathing, bacteria gets trapped in the back of the throat and it gets inflamed and blocks your airway. And now air is the one thing that we need to live. And nobody would have thought that your mouth or your tonsils have anything to do with breathing and oxygen. People always think, oh my God, tonsils, no big deal. We don't need them anymore. Kind of like an appendix, but it really is a really important organ and that we need in our bodies that's actually used to be able to prevent diseases. The only reason it's actually removed is if people have trouble mouth breathing. And that's really the main reason why it gets removed.
Great answer. So I'm going to start from the top. And Jan, I really like to give a lot of analogies in our podcast, and when we talk about general health and GI tract, and we talk about just general health in general. One of the first things we think about is diet, and of course, if we don't have our mouth to chew our food, um, we're not going to have a good diet. We're not going to be able to absorb our nutrients. And one of the first things that a veterinarian does when you take your dog or your cat or a horse, when they give the horse an exam or your animal an exam, the first thing they look at is their teeth, almost the first thing they look at. Um, that's how important oral health is. So just explain a little bit about that.
Well, the oral health is really important, and teeth are really important. There's two most important ways, and the first one is number one, and you touched upon it, which is very a given. If you have your teeth, you're able to chew. If you're able to chew, you get your nutrients. If you get your nutrients, especially the leafy greens, they contain a lot of nitric oxide. Now, nitric oxide is a chemical that helps you fight heart attack, diabetes, cancer, all sorts of stuff. That's why people who have their teeth live an extra 10 years. And I shared that with you earlier. Now, even if we add more layers to it, the most important reasons why it's so important to make sure that you're protecting your mouth is number one, your microbiome. We are learning so much more about their microbiome. We're swallowing 5 gallons of saliva every single day. So 5 gallons of spit. Now that's a lot, right? And so if you have a good microbiome, you're going to have healthy gut bacteria. Now, if you have gum disease or cavities or dry mouth, it's going to make a lot of bad bacteria overgrow. And the bad bacteria are the ones that are linked to the heart attack, diabetes, cancer, Alzheimer's, arthritis that I mentioned to you earlier. Now, there's specific snake-like microorganisms that we can't see, and they're in the spit. And we find that in patients who have gum disease. And can you believe it actually crosses a blood-brain barrier and gets into the brain? And that's how it causes Alzheimer's. So we really know microscopically how important the mouth is now. There was things we knew 30,000 feet up. You need your teeth, you got to chew, it's going to help you live longer. But now we even know it microscopically how important this, this microbiome is. We always used to think that, disease starts in the gut, and it actually starts in the mouth because you're swallowing those 5 gallons of bacteria every day. And from your mouth, they're going straight into gut, and your gut is your immune system. So we really want to make sure that your mouth is super healthy and that keeps the gut healthy.
Absolutely. Janet, what questions do you have for Dr. Patel?
Okay, so that really comes down to good nutrition early in life, correct?
It does. Yes. Good nutrition is really important. And, when we think of good nutrition, sometimes we think of the pyramid, making sure you have your greens and minimizing carbs. When it comes to teeth, the one big thing that we always talk about, you want to avoid snacking. That is the biggest issue. We tend to snack all day. And science at one point told us to have little meals versus having, big meals. And, now the functional data and information is actually coming out to be, the less meals you have, the better. It lowers the inflammation. And from a mouth perspective, what it does, it makes sure that there's, every time you eat, your pH drops to a 2 for about 20 minutes. So, and that's when the cavities and the gum disease start. So if you're not snacking frequently, it actually is very beneficial for you. The second thing is really the types of foods you're eating, avoiding one of the biggest things we hear, especially in Ayurveda, is lemon water, or apple cider vinegar, like we hear that that's really good stuff for us. And it is good systemically, but for the teeth, it will cause so many cavities. So we have to be careful to make sure we actually drink the apple cider vinegar through a straw, or the hot water with lemon through a straw.
So. Yeah, I mean, it's an acid, right? I mean, it's gonna eat your teeth away.
Yeah. So we got to be careful for sure. And then also, the leafy greens are the best. They're really great. You're chewing all of you're using your teeth, you're chewing all of the leafy greens, you're getting that nitric oxide, you're helping that gut microbiome. You're giving you're releasing oxidative stress and really just helping the body function really well on its own. So that's a critical piece. Now, especially when we talk about diet, we really also want to obviously, minimize the carbs, especially, and also crackers. For kids is a perfect example, is that kids love chewing on like little mango chews or gummy bears, even gummy vitamins. All that stuff gets stuck in the teeth and it causes a huge problem. So we want to be really careful. And even with adults, snacking is a huge drink, and even energy drinks, right? Those things are super acidic and just horrific for the teeth and the body, of course, too.
So Janet, you had a question about early nutrients and how to get early nutrients. Are you talking about breastfeeding or?
Well, so I guess where I'm going is this starts early in life. If we're going to have healthy teeth, these habits need to start early. And I think you touched on it, is that, as Americans, as a culture, we have this idea that we should be snacking all day long, and what that does, or even drinking, like you said, if it's acidic drinks, that is going to bring some issues, and that's going to carry over into your overall health. Because usually, I mean, when we're talking about our teeth, we don't think of them as bones, but in a lot of ways, it's similar, right? I mean, you need to build those foundations for that to happen throughout your life.
Absolutely. You have it right on point. And I'm just going to go a little bit deeper with this. And honestly, the first place a good nutrition starts is breastfeeding. So if a child is breastfed, and we actually recommend 2 years. The reasons for that is the colostrum actually builds the immunity for the child. That's amazing. It really helps the child become really healthy, and their immune system is much better when they have that colostrum from breast milk. Now, the second reason from a structural perspective is when the baby is suckling on the breast, what it does, it signals the body to form the teeth properly. It also tells the body to make sure that their sinus cavity forms properly. It also tells the body to make sure their windpipe is formed properly. Earlier, we talked about somebody who needed to have the tonsils removed. One of the reasons that will happen is if they were not breastfed and their structures didn't develop properly. So we actually want to start nutrition as a child, as a baby. Number one is breastfeeding, really getting that milk from the mom because it has that colostrum. Secondly, we want the kids or the babies to be eating. Like, we want them chewing with their muscles. We want them, instead of baby food, we want them chewing on carrots. We want them to play with it, because what that does is gets the myology, or the muscles, to work. As their muscles work, it signals the teeth to be in the right place. It tells the whole body to function in the right place. It secretes saliva for the babies. So it's really important. A lot of other things that we wouldn't think, we would just think food, but the food or the type of food has a massive impact. And when the kids are started with those, avoiding sugar, of course, because then they're not addicted, and they don't have sugar, they just don't want it anymore, which is really awesome as well. But just starting as babies is really key. Instead of baby food, chewing on carrots, broccoli, starting on real foods, instead of something that's pureed or out of a box, something that's fresh without preservatives, something that's natural, is so much better for the kids to start with. And high protein, good protein, lean protein, fruits and veggies, getting those fiber, and really hydration, making sure they're drinking water. That's the other piece that we see with kids all the time. They forget to drink water. And not just kids, adults too, right? We get so busy sometimes, so that we forget such basic things. So absolutely starting, definitely at a younger age, for sure.
So when should you start a baby on solid food?
Well, I would say I like to see children at 6 months, starting on solid foods, and I want them to play with it. They don't necessarily have to eat it, and especially like carrots. chewing on carrots, it's hard. They're probably not going to be able to really, tear it apart, which is okay. But we get their muscles to be working properly. And at 6, they usually start getting their lower front teeth. So they start playing with the teeth. They start really understanding how their teeth are supposed to work and what it's supposed to be like. So I usually say, 6 months is a great time to start children with some solid food, even an apple, but it still has some texture that allows their myology or their muscles, tongue muscles and cheek muscles to work properly and really start the foundation of whole body health.
So I'm going to ask a question that might cause some controversy among some dentists, but I've seen some information floating around social media and the internet that there's some dentists that think that breastfeeding can be bad for babies' teeth. Have you heard that before?
No, from the science and the background and understanding physiology and pathophysiology, form and function go together. We as human beings have been designed to be breastfed. We see it in all of the species, right? It's something that's designed naturally, and we're meant to do this. We're meant to do this, and like I said, it's not just the breast milk itself. It's because it signals our bodies to work proper. As the baby is suckling on the breast, the tongue develops, the sinus develops, the entire functional airway develops, and it's our basis for living. And this is why dentistry is on the map. For a long time, dentistry has been a stepchild of medicine. Nobody cared about dentists or dentistry. It was like, whatever, we'll deal with it if I lose a tooth or if I'm in pain. But really, when we look at how does dentistry impact your entire body, and then neck and up is where things are really controlled. The reason is we talk about our brain controls our entire body, right? Did you know that all of the muscles and the bones are connected? So if we are not breastfed, if the bones aren't developed properly, we're also finding problems in our cranial nerves and nerves that control, they're like the vagus nerve that control rest and digest. People have more anxiety. Sometimes motor nerve functions aren't proper. So there's just some things to start off with, but long term, our bodies are designed to be breastfed. We really are, and the longer the better.
It's what makes us mammals, right?
Right.
Literally, right?
Right.
Okay, so what about, you mentioned a little bit, but I want to hit a little bit more on it because we talk a lot about, cardiovascular disease is the #1 killer of Americans. And we talk about it on our podcast a lot. And there's a relationship between gum disease and cardiovascular disease. I've seen many patients. In fact, I had a good friend that had horrible cardiac disease and he was missing all of his teeth. Can you explain that?
Yes, absolutely. So number one, the most important thing, well, actually, there's 2 reasons why this occurs. So number one, I mentioned earlier, which was the microbiome. We now know specific bacteria that cause heart attacks. Now, we call them red light bacteria. What these bacteria do, you swallow 5 gallons of bacteria every single day. And if you're eating a lot of curvy food, you're going to probably have more of these, right? And so these bacteria go into your gut. And from the gut, they go through the enteric lining and end up in your bloodstream. When they're in the bloodstream, your body's like, hey, snake-like organism, you should not be in the bloodstream. Why are you here? So your body's going to want to attack it. As it attacks it, it binds to cholesterol. As it binds to cholesterol, that artery starts becoming smaller and smaller and smaller. And that's what we call heart attacks. That's number one. Now, second, we've been talking a lot about the tongue. So one of the biggest risk factors for heart attacks is sleep apnea and obstructive sleep apnea, which means your tongue falls back and stops you from breathing. So if that tongue isn't developed properly, or if somebody's gained weight, that tongue isn't suctioning at the roof of the palate like so it's supposed to, it actually falls and it stops you from breathing, which increases high blood pressure and then over a period of time causes heart attacks. So That's the biggest risk factor that we see. And in fact, I'm certified by the Bale-Donine Institute, which is designed to prevent heart attack. They actually guarantee that you will never get a heart attack if you follow their protocol. And part of their protocol is to make sure that you don't have any of these red light bacteria. And number two, that sleep apnea is addressed, because that sleep apnea's problem is actually the tongue.
And what we talk about inflammation a lot also. And I mean, gum disease is an inflammatory disease, right?
Exactly. Gum disease is an inflammatory disease. And, just like we talked about the bacteria is inflammation, right? Because your immune system is activated. And so all of that inflammation over a period of time is what's going to cause the issues. When we're a lot younger, our bodies are more resilient. And as we get older, we're not as resilient, because we have that increase in inflammation because of increase in bacteria. Now, we start mouth breathing more, so there's decrease in nitric oxide, and that nitric oxide is really critical because it lowers inflammation. So absolutely, very important that we decrease inflammation for sure.
Janet, what other questions do you have about Dr. Patel?
So, what about implants? I'm seeing a lot of people doing implants. How does that affect our population with those? Because I mean, it's interesting to me that we're doing that versus doing like, gosh, what would they call that before? Like my parents didn't have their own teeth anymore. They used dentures. There we go. Versus dentures. How does that affect people's overall health?
Wow. Implants, and especially they're called all-on-4s or all-on-5s, it has made a massive impact. And it's really, as we are living longer, it's added a breath of fresh air to the dental world. And especially if people who might be suffering from, some different diseases and have had tooth loss. Implants are really great because it's what they are. It's made of titanium. We also have some made out of porcelain as well. But the titanium, it's kind of like a titanium hip. What it does, it actually integrates and fuses with the body, so it becomes part of its own. And they're like anchors. It's anchors the denture into place, so that way you don't have to take it in and out. And the beauty of these things, the implants, are so wonderful because, when people have dentures, it covers the entire palate, so you can't taste the food, and the quality of life diminishes. And then also you can't chew everything like almonds. They're very hard, right? So you can't really chew hard foods. But when you have implants or an all-on-4 implant retained denture, it's wonderful because you can taste the food. You look great. I mean, they're beautiful. It's like getting a full set of teeth, right? It's gorgeous. They're nice and bright and white, and you feel wonderful around it. You can speak normally. You don't have to take them in and out. You can taste your food. You can chew almonds. You can have whatever you like, and it really adds a lot of freedom to people who've been suffering with tooth loss, and it really is a great alternative. And the quality of life is just amazing with something called an all-on-4. So absolutely.
So other than eating good nutrients and chewing our food and eating real food, what are some more common dental practices you would recommend to keep our teeth and gums healthy?
Absolutely. So that is a great question, and I get that question a lot. So I usually have my little protocol, is what I call it. So the first one I always recommend is flossing your teeth. And I'm going to give you some tips and tricks here as I go along here. So if you don't like to manually floss, there's so many great even electronic flossers out there now. So it really makes a big difference. If not, you can use something called a water pick. And my favorite one is to use the one in the shower. So it makes a mess, but it's in the shower, so who cares? So I always say, water pick first. Electric toothbrush. I highly recommend an electric toothbrush because you hit your teeth with 30,000 pulsations per minute. That's faster than Superman. Like 30,000 pulsations per minute. So you get a real good clean. Now, after that, I recommend, my favorite toothpaste is called Boka, B-O-K-A. It is an alternative fluoride, has no fluoride in it. It has hydroxynanoapatite. Now, hydroxynanoapatite actually helps prevent cavities. It actually is the same material our tooth is made out of. So it packs these calcium crystals into the teeth, so it helps prevent cavities. So it's super awesome. Then I recommend a scrape your tongue. Our body detoxes through our tongue. So super important to use a tongue scraper and scrape your tongue. And it's going to help you for two reasons. One is you won't have bad breath. Number two, you'll actually be taking out the toxins that your body has actually removed. So highly recommend that. After that, I recommend oil pulling. Oil pulling is really fantastic because, again, that oil hydrates the mouth. And my favorite oil to use is coconut oil. The reason is we talked a lot about gum disease. We talked a lot about inflammation that occurs. And what the coconut oil does is anti-inflammatory. It's antifungal, it's antibacterial. So what it does is it kills off the bacteria. One. Number two, it's a great chelating agent. What a chelation agent means is that it binds to any toxicity that's inside of your blood. So let's say, for example, you had heavy metals in your bloodstream. So as you're oil pulling, what it's going to do, that coconut oil is going to bind to those metals. And as it binds to those metals, it's going to pull them out of your mouth, and then you can dump it out and spit it out, is usually what I say. And do it in a trash can. Do not clog your drains. So that is another thing I recommend. The last thing I would say is mouth tape when you sleep at night. What has been happening in the last 100 years is that, we're becoming smarter and smarter and smarter. So using our brains more and more and more. What that's doing from an evolutionary perspective is making our sinus cavities a lot smaller. So what happens is that most people end up mouth breathing. If you look on TV, if you look on celebrities, right, they always have their mouth open, the pouty lips, the sexy look, if you want to call it, right? But really, that's actually horrible for your mouth and horrible for your body. We want to mouth tape. We want to close that mouth up for two reasons. Number one, you don't want the mouth to become dry, because as soon as it becomes dry, it's going to make those bacteria that cause heart attack, diabetes, cancer to overgrow. That's one thing. And second is when you mouth breathe, you don't get nitric oxide. So the reason why mouth taping is really important for a second reason is we want you breathing through your nose always. When you breathe through your nose, what happens is the air is taken in and then it's converted into nitric oxide. And that oxygen goes to nitric oxide. And that nitric oxide vasodilates, so helps prevent a heart attack, right? It also helps your body, and it makes sure your mitochondria is a cellular function. What it does, it helps reduce oxidative stress. So it means that it gets rid of all the bad stuff that's in our bodies and helps our bodies function much, much, much better. So that's why mouth taping is so great for the, obviously the mouth, but also the entire body to help prevent disease as we get older.
Awesome. That was a lot of good information. So Dr. Patel, as we wind this podcast up, what do you have a passion for?
Wow. My passion is helping people with teeth. I love teeth. I love teeth. Oh, and I got to see your smile. So that's lovely. I love to see people smiling. It's one of the most important things because it's not just about teeth, right? And we talked about preventing diseases, but in all honesty, it's the quality of life, right? We kiss others, right? We show affection. We show love. We smile at people to communicate we like them. The mouth is really important. We're speaking, our myology, the way that we speak is really important. We're sharing kind words. We need teeth for that. The mouth is just really important in so many ways. We want to look good. We're, looking good society. So we love to smile, look good, feel good. All of those things have just a massive impact. And I never really thought that I was going to go into a profession that was going to give me so much satisfaction, and I feel blessed. I feel really blessed. So thank you for having me. I really appreciate you guys.
So we're going to stream your website here. Tell us a little bit about the best way to get a hold of you if people have any questions.
Absolutely. So if you have any questions, you can go to drnammypatel.com. I actually have courses. If you're interested in learning more about this information, you can actually learn more about how to prevent heart attack, diabetes, cancer, Alzheimer's, arthritis, and then live an extra 10 years. So you can learn about that. You can listen to podcasts. You can listen to videos. And then we have another, and there's my book right there, Dr. Nammy's Age with Style, Guide to a Youthful Smile and Healthy Living. Because there's so many things you can actually do to actually unravel, stop your telomeres from unraveling, which causes aging. So there's a lot of different things that you can learn on there. You can also learn about just a lot of information. And from there, you can actually go to we actually have a dental practice in San Francisco. It's called sfgreendentist.com. And it's really wonderful because if you're in the area or if you want telehealth, we're able to help you, support you in any possible way. And there's a lot of information, and actually a lot more updated information because we go bounce back between both of the websites, between sfgreendentist.com and drnammypatel.com. So there are lots of information, lots of things you can learn, and reach out to us anytime you have a question. We're happy to help.
I love it, Dr. Patel. So thank you for being on our show. You've helped us realize our goal, which is to educate and empower individuals to take charge of their own health. So thank you for being on.
Awesome. Thank you. I'm delighted.
And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Thursday to our midweek podcast, 8 a.m. to 9 a.m. Pacific Standard Time. Thank you.